I will say this though. The hoop that you have to jump through is a lot wider than you think, I would say. We think that it's, I thought that coming back into recovery and doing it all again, I thought that it was this mountain uphill in the snow with booby traps and rain. And that's what kept me out there for so long in my relapse, is like, it's too much work to get back. And it's really not. It's not. It's a lot easier than you think it is, but you have to be willing to take that first step. And then when things crop up, all those emotions that you've been burying down for so long, to keep going through them, like in spite of them, right?
Yeah.
Because when you numb yourself for so long, the shame comes back 30 times, right? I remember in this third treatment center that I was in, my wife dropped me off. I was a shell of a human. I remember I wasn't even like taking in information. I was just so tired and strung out. The first night I was there, it was the first night in the treatment center, I had like a panic attack from anxiety because I had detox for 4 days before that. So there was like the fifth day. The first thought in my head was my wife, died on the way home. My mom died I wouldn't know. I'm in a treatment center. And so all these things started like piling up and spinning in my head.
Yeah.
A long-winded answer to that question is whenever you have to talk about it. That's the hardest part, is whatever you're going through, you have to talk about it. Hi there. Welcome back, or welcome to Recovering Out Loud podcast, the show where we get real about mental health and addiction. I'm so glad you're here. If you or someone you love is struggling with drugs or alcohol, please reach out for help. Send me a message on all social media platforms at Recovering Out Loud Pod, or by email at recoveringoutloudpod@gmail.com. You are no longer alone. Thank you so much for coming, Kate. I appreciate it. On this treatment journey, I'm learning a lot about treatment centers in Canada. I know I was mentioning to you, I've been to 3. I really like what you said though about, before we started recording here, that there's a lot of people don't know what to look for in treatment centers, right? When they're going for their loved ones or even for themselves.
Yeah.
I know specifically when I was going to rehab the first time, I didn't want to go at all. So I didn't care if it was good or bad or whatever.
Yeah.
I was in a place where I knew I had a problem with cocaine, and I knew I couldn't stop on my own. And I knew that my parents gave me an ultimatum, essentially. Right. And I was 23 years old. It saved my life. I look back and, although it wasn't an amazingly comfortable vacation-like experience, in a lot of ways, I learned a lot of tools early on that I still use today. Right. So overall, it was a good experience, but I found that I had to come to a place where I was like, okay, maybe I'm wrong about this recovering thing, this answer to my drug problem. Maybe I'm wrong. And maybe all these addiction professionals around me who have been to school, have had lived experience, maybe they got something, maybe they're onto something here, right? And I always try to tell people now when they're picking a treatment center, it's like, when you do end up going to one, the most important thing that I ever did was listen to what they say, right? If they're recommending something, it's not because they want to make money off of you most of the time.
Yeah.
They know what they're talking about.
The good ones.
So why don't you start us off? Tell us a little bit about yourself and what you do for CATC.
Okay. A little bit about myself. So my background is, I started my early career in criminology. I have a degree in criminology. And I thought that's what I wanted to do at the time. I started in the correctional service. So I worked in the correctional setting really early on, like early 20s. And I realized what a hopeless negative environment it was. So I think from an early age, I knew that there was a specific population or group of folks I wanted to work with. I just was too young and stupid to figure out how I wanted to work with them or what helping could look like. And I landed in the opiate agonist treatment space actually completely by accident, which is how I came to work at CTC. So I had started on a new sort of career path. I wanted to certify as an addiction counselor, and I'd gone back to school to do that. But it's really difficult to learn about opiate agonist treatment, or methadone is what we had at that time, unless you work in it. That you can't take courses or classes. And it's kind of this little niche sort of ecosystem. So I got a job at a clinic in Kingston, and I thought I'll go there for 3 or 6 months while I'm going back to school and get in and learn everything I can, and then I'll get out and I'll take this. And hopefully that experience will serve me if I'm working with clients who are on methadone. And I never left because I was so smitten with the space. I really, really loved the clients and their resilience. That's the thing for me that is just so crazy about working in treatment, recovery, harm reduction, whatever word or space people want to use or work in. The resilience of people is just so inspiring. And at CTC, I've played a number of roles. So I've been director of operations, I've been director of clinical services. Right now I'm in a strategic partnership role. And I like it. I love it. I get to connect with people all over Ontario. But I'm based out of a clinic. So when I work at home, I work in a clinic because I think it's important to not get too far away from the people that you're trying to serve.
The front lines, yeah.
Right? It's important that you understand what people are going through, both patients and our clients, and also the staff that are there to support them. And I think often, I mean, that's the thing that I love the most, but I think often when people are in leadership decisions or making decisions about things, they do it from too far of a distance.
Right. Yeah.
You know?
That's true with any company. I mean,
it's true.
Like managing behind a desk. Yeah. I worked in corporate for a long time, and it's like, why are you making this policy change? You've never been in the field a day in your life, right?
Exactly. Anyway, did I even answer your question?
Yeah. Yeah, definitely.
Kinda? Okay.
And you brought up what the OAT, opiate agonist treatment, that's what it's called, right?
Yeah.
Methadone. Can you explain that a little more for people? So, opiate addicts.
Yeah.
Yeah.
Okay. So for people who use opioids for an extended period of time, prescription opioids, Percocet, OxyContin, hydromorphone, morphine, that we started as a prescription opioid crisis, right? And it's evolved to become this toxic, contaminated, illicit drug supply. But the human body becomes dependent on opioids when you take them over an extended period of time. So what happens when you try to stop is there's a very, very difficult withdrawal syndrome that's associated with it. It looks like a severe, severe flu. It's not normally life-threatening, although I think when people experience acute withdrawal, they wish they think they might die. And it doesn't, and you can't recover from it quickly. It could go on. It can go on for a prolonged period of time. So there's the physical aspect to it, and then there's like the depression and the anxiety and the things like that accompany with it.
Insomnia as well too. Right?
Absolutely. Yeah. But people, I think, listen, people do white knuckle it. People are able to go cold turkey. But for folks that have to get up, and you might have to parent, you might have to work, you might be going to school, people have to get up and live their lives. It can be absolutely impossible to mitigate or get through this withdrawal syndrome. And I think we have to also acknowledge that when people are using opioids, it's often to manage that emotional pain, right? People talk about the euphoria associated with opioids. And that's another big piece that the medication doesn't actually help with. So the point of taking methadone or Suboxone or buprenorphine, let's call it, is to have safe, prescribed, long-acting opioid. And it removes the withdrawal. And it should also help ideally with cravings. So if you're not in withdrawal, at least you don't feel like you have to go out and find, whether it's a pill or fentanyl or whatever it is.
Yeah, or heroin or whatever.
Yeah, exactly.
Xylazine nowadays and
So dangerous.
all these other ones, fentanyl.
It's so dangerous. Yeah. The challenge with opioid agonist treatment right now is that fentanyl is so powerful. It's so potent. It's cut with so many crazy things that these medications, they're still effective, but it's not effective like it was when we were in a prescription opioid crisis. So it's that much harder to engage people in treatment, to try to keep them on treatment, because it's a struggle, or it's just less effective. And I think the other big challenge in this space, so many folks are, using polysubstances. So there's no good medication-assisted treatment for stimulants.
Mm-hmm. Yeah.
Right? The fentanyl, crystal meth, like the co-occurrence of that, particularly with people who are struggling with housing insecurity, sleeping rough. So you can, even if you can try to treat someone's opioid use disorder or opioid dependence, we don't have a lot of time for stimulants,
Yeah. And I know I have personal experience with the stimulant craving.
Yeah.
It's so, to your point, it's like now I've settled this opioid craving over here. Right. But now I'm depressed. Now I'm, whatever, I'm lethargic, tired, hungry.
Yeah.
And I know what'll fix that, right? It's that dopamine. That's what I need is dopamine.
Yeah.
And that must be really tough. I mean, I've done my fair share of opioids, but they never really stuck with me. And I'm so thankful for that. I would get really sick like for an entire day after. And I mean, I was buying stuff on the internet. Like I probably had fentanyl in my things. It's a miracle that I'm still alive today.
Yeah.
But I've heard that it's definitely one of the hardest ones to get off of is opioids, because I mean, the cravings are so physical, right? I mean, with stimulants, there wasn't, at least in my experience, I don't know, it was more of a mental thing. I remember getting really tired and lethargic and depressed from it. But what does in a perfect world, what does a successful recovery from opioid look like from a medical perspective? Like how is it supposed to go?
I don't know if it's supposed to go any single way, but let's just say textbook or magic wand. It never goes like this. A patient or a person would come in and be initiated on one of several medications. Ideally, it's a really fulsome discussion with their physician or their practitioner. And it's co-decided, after a full explanation of here are the options, here are the pros and cons of both, here are all the things you need to know. I think it's important that physicians or prescribers make a recommendation.
Mm-hmm.
I mean, that is their area of expertise, but I think it's important that the patient or the client is fully informed and able to, make a decision that feels best for them.
Right.
So the motto used to be even a decade ago, start low and go slow. So the stabilization period can be pretty intense. It's actually a lot of work to be on a program. So people have to come in and see their doctor, 2 or 3 times a week, and the medication's being titrated up. You want to make sure that someone is at a dose of methadone or buprenorphine that lasts for 24 hours. That's the goal. Let's get you through a whole day with no cravings and no symptoms of withdrawal. And we want to make sure the dose isn't too high that people feel sedated or drowsy, right? People are supposed to feel okay.
Yeah.
And that tinkering can take a week to 6 weeks, depending on the person. So you've got this sort of visit appointment burden in the early days. People are going to a pharmacy or a clinic every single day to get their medication. Sometimes, it's a commitment. It is no joke. But at some point you achieve a stable dose, and that's when people can ideally start to do whatever other things they need to do to start decreasing their drug use, and eventually move to abstinence. And then you're just maintained on the medication. And then at some point, you would start a taper, and people would taper like a long, sort of slow, gradual taper off the medication, which I think is what lots of people want to believe in. I think people want to think that there's life after this program, because the drudgery of the program, I think, for folks is just, it gets so tiresome and old. You know, even at best, you're coming in twice a month, you know, maybe once a month, but that's a tough one, because if you think about it like a chronic condition, and I'm not on methadone or buprenorphine, so I don't have the personal experience of saying, just stay on it, because, you know, no one says, when are you getting off those puffers? Yeah. When are you getting off that insulin?
Yeah.
You know, like that analogy. So I think it's just so personal for people that say, I've done the work, I put the time in, I don't want to do this anymore. I think people have to support them through that decision and say, you know, these are the things you got to watch out for. We're always here. Please come back if you need to. But I also think we have to give people grace and say, if you want to, if this keeps you healthy and well, and you want to be on this for a long period of time, do that. Yeah. Right? I think there's, for people who do achieve recovery while on an opiate agonist therapy program, there's a lot of pressure from family and friends to like, when are you getting off that? You know? And I don't think any of us get to tell someone what is best for them. So the situation I described isn't always how it goes, and that's okay, because there are so many harm reduction benefits to being on a program, medication-assisted treatment program, and not everyone moves to abstinence quickly, and some people don't for a very long time, and some people don't. Yeah. But they do still get the benefits of being on a program. Yeah. Yeah.
And towards a goal, right? I mean, essentially, if I'm on methadone and I'm not shooting heroin, that's a win, right? Like I used to be pretty rigid about the harm reduction thing, just because my experience was I tried harm reduction and it doesn't work for me. I'm an all or nothing guy. Yeah. I can't do a little bit of anything. Like, I don't know what one is. I've proven that to myself time and time again. Yeah. So that's just me, right? But if I've come a long way in that, you know, if you're smoking a joint and it's stopping you from drinking, or if you're on methadone and it's stopping you from snorting cocaine or doing meth or shooting, you know, and nowadays dying, essentially.
Yeah, that's the big thing.
Right? Like, good, more power to you.
100%. And that in this era of this toxic drug supply, one of the beauties of opiate agonist treatment is that at minimum, people do have some overdose protection. Mm. And that's just huge, right? So you can at least live through the contamination.
And you know, that's not to say too, like I've been on medications in my life where I thought I was going to be on them for my entire life. Mm-hmm. And then you come to a place where you're like, this is kind of more of a prison than I would like it to be. I feel 100%. Like a slave to this, right? Like Vyvanse was an example for me.
Yeah.
I was on ADHD medication for a long time, and I was like, I could do this for the rest of my life. Now I look back and I'm like, there's no way, right? Just to have to take something every day. For me, it was like annoying after a while, and I didn't want to. If I missed a dose, I was freaking out, and then I wasn't myself, right? It's just, it's a horrible place to be.
Yeah, you didn't get to the pharmacy before it closed.
Exactly.
I didn't get my refill, and I think that's the biggest challenge for people on an OAT program. You know, lots and lots of names that are horrible but so valid. Liquid handcuffs, people call that methadone liquid handcuffs, right? Like, it is, and you can understand why people feel that way. So it's hard to balance all of these things. But I definitely understand why people find the program tough to join, tough to stick with, tough to stay on long term. And those of us that are providers of the program, you know, there's rules and things you have to follow. But I really do believe collectively we have to do better to make it easier for folks more accessible for folks. And I don't mean accessible. I think there's tons and tons of access actually, but I'm talking about true accessibility in the sense of it's accessible from a daily life perspective. Do you understand what I mean by that?
Could you explain that a little more? Yeah.
If you think about, I think there's a lot of narratives in Ontario about, or even in Canada, about more access to treatment. We need more access to treatment, whatever treatment looks like. Especially in Southern Ontario. It's not like this in Northern or rural Ontario, but you can go to any pharmacy almost and see a doctor to get on methadone or buprenorphine. So there's an accessibility in the sense of the offering is out there. But once you're on it, accessing it is a pain in the ass.
Yeah.
Do you see what I mean?
Yeah.
8 to 4 hours, those classic healthcare hours where we all have to take time off work, or
you got to line up too, right?
Got to go in every day if you're, if you're not eligible for carries. And to your point, like, what if I miss a dose? What if I can't get there? Like the other anxiety that it can create for people, like all of those things, we have to acknowledge that they exist. And I do think that all of us that are providing these things could put do better to put a patient or client lens on those things, to say what things could we do differently to make it easier. Yeah.
Instead of going to the alternative, right? And which nowadays is, like we said a million times, the accidental overdose from fentanyl or xylazine or nitrazine is the other one now that keeps coming up. So when I went to rehab in the States twice, methadone was not a thing there. Like in the treatment centers that I was in, all the opiate, and there was a lot of opiate addicts. The treatment centers I went to, I think the U.S. has a bigger problem with opioids, but I mean, there's more people, but they definitely, there's an opioid crisis across the board, right?
Sure.
No doubt about it. I think it's more prevalent in my experience in the treatment centers in the US, in terms of, and what I mean by that is, I've been to rehab here and it's kind of a wide variety. There's alcohol, there's weed, there's gambling. When I went to the US, it was a lot of opioid addiction and specifically heroin. They use Suboxone down there almost exclusively. Yeah. Why haven't we switched to Suboxone? Do you know like what the difference is between the two?
No, it's a really, really good question. We use both. Like in Ontario, both are available. Okay. So methadone used to be the gold standard. Yeah. Suboxone or buprenorphine didn't exist. It was introduced, I want to say 2008 in Ontario. Don't quote me on that. And then it got on the ODB formulary shortly after that. And that's when you actually people get to access it. Because until something goes on the formulary, people have to have great insurance or a lot of money.
Could you explain that a little more, the formulary? What is that?
So people have to, if you go to an OAT program in Ontario, the medical service is part of it. So your physician or nurse practitioner, like your physician visits, let's say, are covered by OHIP. So it's like going to any sort of healthcare in Ontario, but someone's got to pay for the medication. So you've got options, which is some people have private insurance through work.
Okay.
Some people work, but they don't have private insurance, and those folks have to pay cash for their medications. And then you have the ODB formulary, which is for people who are Ontario Works or the Ontario Disability Program.
Okay.
It's also Trillium drug benefits or OHIP Plus, which is like for youth, right? So that's the provincial drug plan essentially. And 80% of the people that are on our OAT program access medication coverage through ODB, the ODB formulary. It's huge. It's important. Without that, nobody could access treatment medications. Yeah.
Okay. Interesting. And so just because, I don't meet a lot of people that have been on the Suboxone. It's mostly methadone. Is
really?
At least in my circles that I've hung out with. But I guess, so when you go to your doctor, there's an option to do both. Is that kind of.
Absolutely.
And
Yeah.
the main difference is Suboxone. This is coming from an addict, right? Not a doctor or anything, but you can get high off methadone. You can't really get high off Suboxone. Is that
No.
false or true?
False.
Okay.
I guess let's define high. If you take enough of anything, you can get high, I guess. So with methadone, taking too much methadone, if you take too much methadone, if your dose is too high, you're going to feel sedated. That's what high is going to look like.
Right.
It's going to be sedation or
Okay.
drowsiness. Less so with Suboxone because it's only a partial agonist. So there are two different kinds of molecules. Methadone's a full mu agonist and Suboxone or buprenorphine's a partial agonist.
Okay.
So there's a ceiling effect. It actually has a better safety profile. Very difficult to overdose on buprenorphine. So it's a nicer safety profile for the patient, but it's also a nicer safety profile for public safety.
Right.
So if it got into the wrong hands, it's far less likely to have a negative impact, if that makes sense, than methadone, because it's just stronger.
Yeah. Okay.
Does that make sense?
Yeah, fair enough. Yeah.
Okay.
And I mean, so you mentioned it a little bit, but what do you think that we are doing well within this space right now? And what do you think we could improve on? Something that you would improve on?
Oh, I don't know. I don't want to say we're not doing anything well. I think that there are a lot of people trying really hard to find safe, evidence-based, but innovative ways to mitigate this fentanyl or this toxic drug supply. And I think it's just such a priority for so many clinicians, social workers. I mean, name it, anyone in the helping space is trying to figure out what that looks like. And our systems are so complicated. So, poverty, the housing and homelessness, like all of those things make it so much more challenging. And I think there's a political narrative right now that is ignoring the evidence and around harm reduction and some of those important things that are really difficult. So what I like right now, or think is going well, is people are aligning to try to protect those things and not let them be forgotten and try to move this forward. If this were any other disease base, someone would have invented a better medication.
Yeah.
Right? But nobody cares about this disease base because of the stigma associated with it. What do I wish we could do better? Stigma. Right? And it has to go away. It never will, I'm sure, but I think we need to keep raising it in terms of everything to do with substance use and substance use disorders. I don't think we ask for patient or client feedback nearly enough. Going back to that, remember you and I talked earlier about the people that make decisions and policies and what do they know? And that's not to say that there aren't lots and lots of really great, smart folks working in this space, but I don't think we engage the people who want or need or might be interested in the services enough to say, what should we be doing differently here?
Yeah. I mean, that's what I'm really focused on too, is one of the reasons I'm getting into this field that excites me a lot is that I'll have a perspective that, and that's not to say there are a lot of people in the field that have lived experience.
Absolutely.
That I've met.
Yeah.
But yeah, I agree. It's like with any good organization, business, company, it has to be a democratic approach, right? Like, what do you think? What do you think? It never goes well if it's like, this is the way it has to be because this is the way we've always been doing it. And I mean, people are dying every day, right?
Yeah.
And it has to stop, right?
Absolutely.
So, do you have any like stories or cases, specific clients that have kind of stuck around with you over the years?
Yeah, so many. And sometimes I think about of the people I've known when you hear what folks have lived through, really, really, really horrible traumatic experiences. And yeah, there are so many, but just sometimes it's just a feeling I think about during the holidays, for example. And, a lot of people who are feeling isolated from friends and family, maybe living in poverty, maybe not going to be able to see their children. If they have children, aren't able to provide the Christmas that they want. There's a lot of pressure, around that. It can be a really, really tough time for folks. And those are the folks that come in, during the holiday season, excited and smiling with a handmade card, or spent their money on a gift for the staff to say thank you for taking care of me. And I think, wow, we don't deserve this. And in spite of, all of the crap life's thrown at you, you were trying to be joyous and think about other people during a time. Does that make sense?
Yeah.
Things like that are just so mind-blowing to me. Going back to the resilience that people have, it's just a reminder every day to be so grateful, to me, and I hope to everyone else that has the privilege of getting to know these folks and working and supporting these folks. We have this thing in our organization. It sounds silly, but it's so meaningful. We have a birthday card program, and so the goal is to give everyone a birthday card on their birthday, or the day closest to their birthday that we'll see them. And people will call back. I'll give someone their birthday card and they'll call back later in that day and say, it was the only thing I got. They'll be tearful. It's the only thing I got. And thank you so much. That meant so much to me.
Yeah.
Dude, we gave them a fucking card.
Yeah. I mean, yeah, when you're in that world, you feel like nobody is thinking about you, right? And so when somebody does something small like that, it's the world. Yeah, I get it. As you were talking there, I was thinking about, before I got into this space of recovery counseling and addiction counselor, I would always ask, not always, but I would often ask, you see so many people over to the staff at the rehabs that I was at, and the nurses, and you see so many tragic stories, right? And a lot of them don't end well. How do you keep going? Like, what do you keep? And I remember they would always say, it's that success story, that one or two or three or four people that succeed and they get through it and they come off methadone. There was a guy in treatment that I was with, we became very close. He blind tapered off of methadone in treatment, and we had this huge celebration. Yeah. And I remember thinking at the time, I was like, I didn't understand why it was such a big deal, but I had somebody explain to me how hard it was to get off. And I've heard from every opiate addict I've ever talked to, they say it's harder to get off methadone than heroin. Like, it's the hardest drug to kick. Yeah. And so for him to do that in treatment, and it was a huge deal, right?
Absolutely.
And
absolutely.
that's what keeps them going, is those success stories, right?
Yeah. Yeah. I think it's the same. I think too, I worry about the word success. Do you know what I mean by that? Yeah. Because what some people I think feel really, really proud of and define as their own personal success might not be your definition or my definition.
It's subjective for sure. Yeah.
Right. And so I think that's just always an important thing to keep top of mind. But I think it's I don't know what keeps different people going. For me, it's that gratitude piece, which is just feeling like it's a privilege to get to know people, and how inspiring it is when, despite some of the biggest challenges, like I don't have a safe place to live, and I've, some bad things have happened, and there's all kinds of stress. People are still fucking funny.
Yeah.
Like, you know what I mean?
Yeah.
The ability to laugh and be humorous in spite of all of the, that's so inspiring, I think. Yeah. People are still so talented, right? In the face of using talents like incredible artists and musicians and stuff, channeling pain and that sort of thing and producing these amazing things. You don't want them to produce these things because they had painful experiences, but that's inspiring. Do you know? Yeah.
Yeah, there's a reason there's a lot of successful, again, I use that word.
Tortured artists.
A lot of, exactly.
Yeah,
like,
exactly.
Anthony Kiedis is one that comes to mind from Red Hot Chili Peppers. He's, I don't know if you've ever read his book. I
haven't. Is it good?
Yeah, it's called Scar Tissue.
Yeah, I know it.
I read it in Rehab.
Yeah.
And that guy, the amount, every page I was reading in that book, it was like, and then I got clean, and then I went to, I was doing this and that, and I was helping guys, and then I relapsed again. And it's just like, it happened like 35 times in the book, and I'm reading it and I'm like, this he's so resilient. Right?
Yeah.
A lot of people don't like that word too, but I love it. It's true. Resilient.
I know. I don't know. I like it.
I like it too.
I'm sorry if people don't like it. But
it's true. I mean, whenever I, I don't know, spill my milk on the floor or something, and it throws off my whole day, and then I think back to like all the shit that I've been through.
Right?
It's like, what am
I know.
To your point, the gratitude thing is like someone cuts me off in traffic and it ruins my whole day, and then it's like, dude, you were homeless for a long time. Like, I had nowhere to live, and I couldn't stop using drugs. I think you're gonna be okay.
Yeah, I know. I know. Is there a better? What word should we be using instead of resilient? I don't have a better one.
No, it's
perseverant,
not even consistent, maybe, but
strong.
Yeah, strong, persistent. Yeah.
Okay, I'll say that.
When I was in my relapse, my wife bought me this bracelet that says strong on it in, I guess, Morse code.
Oh, cool.
And yeah, it's funny that you bring that up, because
strong's a good word.
She would always tell me, it's like, you're stronger than your disease, right?
Yeah.
And, I find that it's just that first step that is the hardest in my experience to get back, to get sober, it's like anything in life, there's a lot of help out there, right? Wonderful people like you and CATC and your organization, but I have to put my hand out. And then when someone puts their hand back, it's like, you have to like take their hand, right? I can't tell you how many times people reached out to me when I was in my relapse, and it was like, too ashamed, too embarrassed, too sad to just take that step.
Yeah.
What do I have to do?
Can I ask you a question?
Yeah.
Okay. What for you, like advice for people working in the field, what little things can help remove feelings of shame?
Because that's the big one.
It is, right?
That's probably the biggest one.
I agree.
I'm a master of feeling that emotion, because I relapsed after 8 years. I had 8 years clean and sober. And so the walk back to recovery, after all my friends at the recovery community group that I was at, to be able to, the group that I was at too, we had to go around and we celebrate like early sobriety dates. And I'll never forget the day I had to raise my hand and say, Anthony, alcoholic, I have 1 day sober. And I just started bawling my eyes out in front of this room full of men. It was a men's group that I was a part of. And I'll never forget it. They just came up to me and all hugged me. Like 16 different guys just came up and said, so advice. Yeah, it's always a tough one, because like, we don't do well with advice addicts. But I will say this though, the hoop that you have to jump through is a lot wider than you think. I would say we think that I thought that coming back into recovery and doing it all again, I thought that it was this mountain uphill in the snow with booby traps and rain, and that's what kept me out there for so long in my relapse. Is like, it's too much work to get back, and it's really not. It's not. It's a lot easier than you think it is, but you have to be willing to take that first step. And then when things crop up, all those emotions that you've been burying down for so long, to keep going through them, like in spite of them, right?
Yeah.
Because when you numb yourself for so long, the shame comes back 30 times, right? I remember in this third treatment center that I was in, my wife dropped me off. I was a shell of a human. I remember I wasn't even like taking in information. I was just so tired and strung out. The first night I was there, it was the first night in the treatment center, I had like a panic attack from anxiety because I had detox for 4 days before that. So there was like the fifth day. The first thought in my head was my wife, died on the way home. My mom died I wouldn't know. I'm in a treatment center. And so all these things started like piling up and spinning in my head.
Yeah.
A long-winded answer to that question is whenever you have to talk about it. That's the hardest part, is whatever you're going through, you have to talk about it. Whenever I work with new guys, this is the hardest thing, but whenever I work with new guys, when I tell them all the time, when you have a craving, when you want to drink, when you want to do drugs, pick up the phone instead of a drink, right?
Yeah.
And who's going to do that? Like realistically, on paper, sounds like a horrible idea, because if I want to drink, I'm going to drink, right? Like and I remember I used to laugh when my sponsor used to tell me that early on, but it worked. Like I started to do it. I started to, even the littlest inkling of, oh, I thought about cocaine today. I got to get this out.
Yeah.
Because it's going to eat me alive. Right. So with regards to shame, it's usually secrets keep us sick. We're only as sick as our secrets is a common one that I hear.
Yeah.
Anytime I had a secret, I relapsed. It was only a matter of time, because one secret leads into more lies, and then you're spinning up this whole story, and then you're not telling the truth about anything. Right. So,
yeah.
I don't know if that answered it, but
it did.
Yeah. It's a tough one, right?
It's a hard question. It's a hard question, because I think that's a big challenge, and I don't know that there's just one answer. Mm-hmm. But when someone is isolating because of that shame, you know what I mean? What little ins, or how can you kind of get, I think that's a tough one for folks. I think it's particularly hard for friends and family,
Absolutely.
Yeah.
I'm just thinking about, because you asked me about the social worker, or advice to somebody helping someone, a loved one.
Yeah.
And I just realized that I answered it from an addict perspective, but
that's kind of what I wanted you to do.
Okay,
though.
Great.
I think.
Because it's like, what can you do to help sort of level out the shame from an addict, right? Is like another way to put it.
Yeah.
You can't be judgmental, I would say. The best thing my wife ever did was, whenever I told her I relapsed, or whenever I told her I was having a rough day, at no point in time was she like, are you fucking kidding me? What's wrong with you? You know what will happen if you use, like, there was none of that language. Right. And so it opened up a safe space for me to share going forward.
Yeah.
So that would be my answer, is like, we have to create a non-judgmental, safe environment where it's like, you can tell me anything, and the worst I'm going to do is laugh at it. That's like the worst I'm going to do, because it's funny. It's funny that you're having thoughts about using a drug that almost killed you. It's kind of funny, right? Yeah. But I'm not going to judge you for it.
Yes.
We're going to laugh at it together and realize that, I'm an addict, and these thoughts are going to come up. It's normal. It's totally normal to be thinking about drugs when you're not using drugs.
Yeah.
It's what you've been doing your whole life.
Yeah. You raise a good point, because I think when people are working in the space, whatever the role is, there's this desire to want to fix things and tell people how they're going to fix things, which I also think can contribute to, I think that can be perceived as judgment. And it's really, really hard to keep your mouth shut.
Yeah, that's a great point.
Right? If someone's willing to tell you something,
just listen.
Just listening, right?
That is a great point.
Sometimes all you can do is just listen.
Yeah, just be there.
Yeah. No comments needed.
I struggle with that so much.
Well, we all do.
Most of the time, people just want you to be there. Right?
Yeah.
And
yeah.
That you're listening.
I know. A lot of people, I think, especially around grief, things to do with grief. People are like, I don't know what to say. I'm so uncomfortable with grief. I don't know what to say. Don't say anything. You don't have to say anything. You're just holding the space, or I know that's kind of a thing people don't like to say anymore either, but you're literally just listening and being there. That's it. That's all you got to do.
People don't like that, holding the space.
I've heard people say, why what does that mean?
I like that.
Yeah, holding space.
You're allowing silence.
Yeah.
Right? You're being comfortable in the uncomfortable.
Yeah. But a lot of people aren't comfortable
Yeah.
with silence, right? But don't just this need to tell people how to fix things, say stupid things like whatever inspirational.
That's not needed right now. And to your point, actually, it's like if you're not doing things this way, now you've failed, right? That's kind of the way I look at it.
Yeah.
And it's like, this is the way to get sober, and you either do it or you don't, right? I've been guilty of that for sure, is like telling people this is the way to do it. I think
we all have.
Right. And it's like when I don't meet up to that expectation, now I don't feel, I'm like.
That's where you feel judged. Yeah.
I failed.
Yeah.
In my mind.
Yeah. I don't think we ask enough either, like, what do you want to do? And it's like, you should do this instead of, what do you want to do? What do you want to do now? Yeah.
What do you think that's why these open-ended motivational interviewing is a great one, right? Like
100%.
What do you think would happen if you went to rehab today? Like what do you think would happen? What's the worst thing that would happen? Exactly. And then it gets people thinking like, I'd be away for 30 days. Hopefully I live to 85. So 30 days is probably 0.008% of my life.
Yeah.
Right? These are all things that I'm saying now, but I laughed at because when I was in treatment for 60 days, it felt like an eternity.
Yeah.
It really did. Rehab is not fun. Nobody wants to go to rehab. Actually, I've met some people that have had a good experience. Like they've enjoyed it. Right?
Yeah. I think it's scary for folks.
Yeah.
So, yeah. I think what's also scary, I don't know how you felt about this, but I've had situations in my life I remember thinking, I don't know how I'll ever laugh again or have fun again without alcohol or without whatever it is. And then I think that thinking it's let alone going away for 30 days and having to follow some rules and engage with folks maybe didn't, all those things. But just that, but just that whole who am I without that, and how will I laugh or be happy or smile or feel good is, I think, just so terrifying.
Yeah. The best advice I ever got to that one, and like this one actually worked for me every time. It still does. When I first came into recovery, it was, how am I not going to have a drink on my wedding day? Like that was my thing. It was like, I'm 23. Like cocaine's a problem. I get it. Alcohol now, you're telling me that I can't have that either, and I might be an alcoholic. That was a huge one to wrap my head around, and I find with a lot of drug addicted people, that's a big one to wrap their head around. The best advice I ever got was, dude, just don't drink today. Just get to bed sober today, and then tomorrow do it again. But don't even think about that, right?
Yes.
Just today. And I've often told people this that I've worked with, and they seem to like it. I use it. It's like, sometimes I got to break up my day. Just don't drink for the next 15 minutes. Like, I tell people sometimes to write down 15 minutes, check, made it to 15 minutes, another 15 minutes. Like that's what I had to, a lot of people have to do that early on.
100%.
Because I can't see past 15 minutes right now.
Yeah.
I want to do drugs. That's all I know.
Yeah. Yeah.
Yeah,
absolutely.
So, in your opinion, what do you think the people that achieve long-term sobriety, so maybe past a year, or I'd say probably past a year. Some people would disagree with that, but I think a lot of people relapse in the first year. It's common. What do you think works? What do you think those people do that help them achieve that long-term sobriety?
Oh, listen, I think people, I don't know. I think that some people are a little bit more fortunate to have a support system.
Yeah.
Like, you mentioned your wife, and at no point did she ever say, make you feel judged, or she wasn't angry, whatever that looks like. I don't know that everyone's that fortunate. So I think that support system is important. I think having to go through this alone, go through those things alone, or with the opposite of a support system. Because some people are living in a pressure cooker.
Yeah, throwing rocks and stuff, right?
Right?
Yeah.
You know, I think that's really, really hard. I think it's hard for folks because a lot of the time, and I don't know what your experience was like, but the change isn't just around the substance and leaving the substance behind. You're leaving a lot of other things behind too, right? That group of friends, that lifestyle, that's a lot of changes. And I think how people's ability to fill those things with other things can be more difficult. I don't even know if I'm answering your question, but do you understand what I mean?
I'm happy that you went on that sort of direction because, yeah, I think support system from family is probably what I see most.
Yeah.
And filling your time with passions and hobbies.
Yeah.
Right? But you know what the tricky thing about that is, it takes time to know even what those are.
It
because
does.
Your passion for so long was going to the bar and drinking or shooting up or snorting, whatever.
Yeah. And if you did have something you were interested in, you were fucking hungover or whatever to do it. Like
you lost complete interest.
100%.
So it takes time to even get to that place.
Yeah.
And then when you get there, it's like, well, what am I going to do? Go for a walk every day? I don't want to do that. Right?
Yeah.
That helps me, honestly.
Yeah.
Like just going out in nature. That's one of my passions, right? Doing things, my wife and I, we do a lot of things outside, not as much as we used to. I mean, it's also not as warm, but the ability to just be present in nature, it helps a lot.
Huge. Yeah, absolutely.
Let's end with this.
Okay.
What would you say to an addiction professional that's just starting out in the field? Like or maybe what's the best piece of advice you got?
I don't know that I don't want to say I didn't get good professional advice, because I did. I had a lot of great teachers and mentors and clinicians that I've worked with, but I'm going to repeat something I said earlier. The shut up and listen piece is so important. So I think for anyone starting out, in whatever space they're looking for, and listen, sometimes it's your job to educate folks, or it's your job to teach them new skills or that sort of thing. But I think depending on, who you're working with and in what capacity, just having the ability to just listen and not feel this need to always tell people what to do, what their solution is really, really important. Does that make sense? I know, it's not very profound, and it's pretty simple, but
it's true. And I think asking the right questions goes along with that too, because my
100%.
first thought is, I've met a lot of people that are trying to get clean and sober that they don't want to put a sentence together, right? They're just so in their head that it's like, what am I supposed to do? Just sit with them for an hour, right? That's my first thought, but maybe they haven't had someone sit with them for an hour ever.
Absolutely.
Right? So maybe that's what's, get out of your own way and get out of your own head and just into their world. And I agree. It's like, we can always ask more questions and open-ended questions. And
I'll say one more thing.
Please,
and again, it's not very profound, but don't take anything personally, right? I think probably in every career, but especially in helping fields, people have a tendency to take things personally. Not everyone is at their best, right? If they're, using substances, trying to quit using substances, whatever that newly not using substances, not everyone's at their best no matter what, even if they don't use substances, but just not taking certain interactions personally, because it's literally not about you. It's never about you. Does that make sense?
Yeah. Robin Williams said, everyone's walking around fighting a battle you know nothing about, right?
Yeah.
Like everybody.
Everybody. Absolutely.
It's just good life advice.
It's true. It's true.
Don't take things personally.
Yeah.
If people want to get sober, where can they go to get in touch with CATC? How does that process? What does that process look like?
We actually have a pretty cool process. So we have a website, CTC, but we have a toll-free number, and anyone can call and just ask a question, feel things out. If people don't want to talk on the phone, we can text them back. Some people don't want to talk, right? Texting is a little bit more comfy. Some people don't even have the ability to dial a phone, without a phone plan. But I think the other thing is that if you make that call and you want some help with something we can't help you with, we'll point you in the right direction. If that makes sense, we'll help you figure it out. So it's just literally one phone call or one email, and we can help people start the conversation in whatever way that's the most comfortable for them.
I love it. One of the things that frustrates me the most is when I hear I don't have money to get sober, right? There's so many free resources in Ontario and Canada. RAM clinics is one of them, just off the top of my head.
100%.
So many that are covered.
Yeah.
You just got to do some more research, or to your point, ask, right? Don't be ashamed. Like if you don't have money to do said rehab, said program, whatever, private, anything like that.
Yeah.
Like a lot of people don't, you know what I mean? Don't be, I don't have that money.
Yeah.
It's like, you're okay, man. Like a lot of people don't have money to go to treatment.
Absolutely.
Nobody has a rehab fund.
No.
But we make it work, right? And there's other ways around it.
Absolutely.
So don't let that hold you back is what I would say.
Yeah. I think the nice thing with like a phone call or email is you can just start out anonymously, right? You can just sort of like ease into it if you're feeling like you just want to ask a few questions without saying, hi, my name is so-and-so from, it's just.
I work at.
Just ask some questions.
Don't tell my boss, please.
Yeah, exactly.
I love it. Thanks so much, Kate, for coming down.
Thank you.
I had a great time. I appreciate it. And look forward to chatting again soon. Thank you.
Thank you.
Thanks for listening. Please help us grow the channel and like, share, and subscribe for more content. The discussions and stories shared on this podcast are for informational and motivational purposes only. This content is not a substitute for professional medical advice, addiction treatment, or therapy. If you or someone you know is struggling with addiction, please consult a licensed physician, addiction specialist, or mental health professional. You are no longer alone.